Good to have with you if you ever do need to do CPR. I don't know how often those things get used unless you're carrying them in a specifically designed thing that is meant for CPR. But
Well, I mean, the one
Yeah.
nice thing about this one they gave us before everyone I've seen, it's been a hard plastic case like clamshell.
yeah, that one's
Which
a little bit softer.
this one being softer, you're able to be a little more pliable with it. Like I could easily see putting that in a pocket.
So airways, one of the things that I don't know how you felt, Max. I was struggling with it throughout the night is getting a good seal on the mask, especially with the dummies. I always find them really difficult to get the right chin angle, and you have to like really move them really far back to be able to.
Right.
In one statement, like, okay, for the infant and for child, like, don't tilt the head back as far. The only way we got a good seal was to crank the hell out of the neck. I mean, granted, it's a dummy. I understand, but it's like if you're trying to practice a specific skill that's different from normal, you would think that the apparatus you're using would coincide with that, not require you to jack it like the head's about to pop off.
Well,
It would be nice.
I have a theory, and I want to ask you, Jonathan, because you have the real world experience, and I assume you've used those CPR dummies a bunch,
Yeah.
a time or two.
A time or two.
Is it as difficult to get an open airway from a patient, like laying with their head flat, and like doing a head tilt chin lift? Like, is it as finicky on a real patient as it is on those dummies, or do the dummies add like an extra set of difficulty so that you're basically overemphasizing or kind of making sure you get the technique right when you get into the field? I'm just curious.
I would say that the issues between the dummies and a human being are different.
Okay.
I would say that I actually just helped a coworker like do her CPR certification, and we were having a very similar issue. Actually, it was Thursday night, so it was after you guys had already done yours on Wednesday night. But she was having a very similar issue to getting a good seal on the mannequin to get adequate rescue breaths. And these mannequins at this facility actually had feedback devices, and so they had to be within that ideal range for her to actually pass her certification.
Yeah.
So she was having some difficulty.